All right, let's dive into something pretty amazing today. Whole body MRI and how it's changing how we find cancers. I've got a stack of research papers, notes, even a presentation you sent over. So we're not messing around, are we? To help us through all this, we've got an expert here who really knows this stuff inside and out. So can WB-MRI really find these hidden cancers, the ones that don't have symptoms yet? How do you know if something's a real threat or just harmless? And what about this OncoRads thing I keep hearing about?
Yeah.
Guess we better get started.
You know, the fascinating thing about WB-MRI is that it can actually find cancers we weren't even looking for.
Oh, okay.
It's called opportunistic cancer diagnosis.
Ah.
It's almost like, you know, when you find some money in your pocket that you'd forgotten about.
Yeah.
Except this time, well, it could actually save your life.
That's one heck of an analogy. But before we get too excited, let's make something clear for our listener. We're not talking about screening everyone with this, right?
Right, you got it.
Yeah.
Right now, WB-MRI isn't used to screen the general population for most cancers. It's a whole other conversation about costs and benefits and whether we're causing more worry than good. We're focusing more on how it's used in specific situations, you know?
Got it. So, like, say someone's getting a WB-MRI for a back problem or something, and by chance, the scan picks up a small tumor in their lung. Is that kind of what we're talking about?
That's it. That's exactly it. It's like you're looking for one thing, and boom, you stumble upon a vital clue about something totally different. And that's where it gets really interesting.
Yeah.
Because now we're talking about a cancer that might not have been found for months or even years.
That's incredible. But I can imagine that raises a ton of questions. Like, how do radiologists know they're not overreacting to every little thing they see on these scans?
Yeah.
If it's so sensitive, it must be picking up a lot of stuff that's totally normal, right?
That's the real challenge with WB-MRI. You're absolutely right. You get a lot of what we call incidental findings, things that aren't the main reason for the scan. And these findings can lead to more anxiety, more scans, even biopsies that might not have been needed at all.
Oh, wow.
That's where the radiologist's expertise, especially those trained in oncology, becomes super important.
So it's not as simple as looking for a broken bone. You're searching for really subtle signs of something that could be, you know, life-threatening.
Exactly. Imagine being a detective, but instead of looking for footprints or fingerprints, you're looking for tiny changes in the tissues, the blood flow, even the structure of the cells themselves. And to help radiologists make sense of all this information, there's a system called OnPORADIS.
Okay, now we're talking. Let's break down this OnPORADIS thing because it seems like the key to understanding all this. Is it like some secret code for radiologists?
Not exactly a secret code, but it is a standardized way to communicate about what we find on a WB-MRI scan.
Okay.
It makes sure that scans done on different machines, even in different hospitals, can be compared.
Right.
And that radiologists are all speaking the same language when they interpret those scans.
So it's like having a universal translator for WB-MRI?
Exactly. Think of it like this. We have these categories ranked from 1 to 5, OncoRads 1 to OncoRads 5.
Okay.
And they're based on how likely it is that something is actually cancer. This helps doctors and patients make informed decisions about what to do next.
So if you have a high OncoRads score, that means you need to take action fast. But if it's low, you can probably relax a bit, right?
That's the general idea, yeah.
Okay.
But each category has its nuances. And we have to remember that OncoRads is just one piece of the puzzle.
Right.
The patient's medical history, other tests they've had, and their overall risk factors all play a role in what we decide to do.
So it's not like getting a grade in school. It's more like a tool to help guide the conversation between the radiologist, the patient, and their doctor.
Precisely. And speaking of conversations, one of the most important things is how we communicate with the patient.
Right.
Radiologists need to explain these findings in a clear and compassionate way, you know, make sure the patient really understands what the scores mean and what might happen next.
Because even a low OncoRads score could be scary if you don't know what it means.
Exactly. It's all about context.
Yeah.
And that context can be different for everyone.
Right.
What might be a wait-and-see situation for one person could be something that needs immediate attention for someone else. It all depends on their age, their health history, all sorts of things.
So OncoRads isn't just about categorizing findings. It's about using those categories to provide personalized care for each patient.
You got it. And that's why having a radiologist who's specifically trained in oncology is so crucial. They have the experience to interpret all the little details of the scan, and they can tailor their recommendations to each individual patient.
This is starting to make a lot more sense now. But can we actually see OncoRads in action? Like, do you have any real-life examples from those research papers that might help our listener understand how this works in practice?
Absolutely. Let's do it. Let's start with a case from one of the studies. A 65-year-old man had a WB-MRI as part of a general health check. The scan showed a large mass in his kidney, which was classified as on-ALK-RADS 5.
Okay, on-KuPe-RADS 5, that sounds serious.
It is, definitely. On-KuPe-RADS 5 means there's a very high probability of cancer.
Right.
In this case, further tests confirmed it was kidney cancer.
Oh, wow.
But thankfully, because it was caught early,
Yeah.
he was able to have surgery, and he's doing well now.
Wow, that's amazing. That's a real testament to the power of WB-MRI and OncoRads working together to save lives. It's like finding a needle in a haystack, but in this case, finding that needle made all the difference.
Exactly. Early detection is often the key to successful treatment, and sometimes WB-MRI can pick up on things that other tests might miss. You know, there's another case in the research about a 49-year-old man who was having some reflux problems, and his WB-MRI showed a small mass in his esophagus, also classified as OncoRads 5.
So not all OncoRads 5 findings are these big, obvious tumors. Sometimes it's about finding something subtle that can easily be overlooked.
That's exactly right. And in this case, it turned out to be esophageal cancer.
Oh, wow.
A type of cancer that can be very aggressive. But because it was caught early, thanks to the WB-MRI, this patient had a much better chance of a positive outcome.
These cases are fascinating.
Yeah.
But they also make me think about something you mentioned earlier, the high rate of incidental findings. If WB-MRI is this good at finding things, doesn't that also mean it's finding a lot of things that aren't actually a problem?
You're absolutely right. That's the double-edged sword of WB-MRI. It's incredibly sensitive.
Yeah.
Which is great for finding cancers early, but it also means we pick up a lot of benign abnormalities that might never cause any harm. And that can lead to a cascade of unnecessary tests and procedures, not to mention a lot of anxiety for patients.
So how do we make sure we're using this incredible tool responsibly? How do we find that balance between early detection and overdiagnosis?
Yeah, that's the big question, isn't it? And it's something researchers are really working on. There aren't easy answers, but there are definitely ways to make sure we're using WB-MRI in a smart way and minimizing any potential downsides.
Okay, well, I'm all ears. What are some of the key do's and don'ts when it comes to WB-MRI for finding cancer?
Well, I think the most important thing is to be careful about who gets a WB-MRI in the first place. It's not for everyone, you know. The research we've looked at suggests that it's most helpful for people who are at higher risk of developing cancer.
Okay, so like people with a family history of cancer, for example.
Exactly, yeah. Or people who have certain genetic predispositions that make them more likely to get cancer. In those cases, the potential benefits of finding a cancer early are more likely to outweigh the risks of finding things that might not be a problem.
Right. It's like using a really powerful microscope when you need to see the tiny details, not just for a routine checkup.
Perfect analogy. And speaking of checkups, another important do is to use WB-MRI along with other cancer screening tests, not instead of them.
So you wouldn't skip a mammogram just because you had a WB-MRI.
Exactly. Each test has its own strengths and weaknesses. Using them together can give us a much clearer picture of what's going on. Think of it like having multiple witnesses to a crime.
Okay.
Each one might see something a little different, and together they can give you a more complete story of what happened.
That makes sense. So we've got be selective about who gets the test and use it alongside other tests. What else should we keep in mind?
Another crucial do is to make sure the scans are being read by radiologists who are experts in oncologic imaging.
Okay, not just any radiologist can read a WB-MRI. It's not like looking at an X-ray and seeing if a bone is broken, right?
Right. WB-MRIs produce a massive amount of data, and it's complex data. It takes special training to know what's normal and what's not, what might be a sign of cancer, and what needs more investigation. It's kind of like being a detective who specializes in a certain type of crime.
Okay.
You need to be able to see those subtle clues that a general detective might miss.
Got it. So be selective, use it with other tests, and make sure there's an expert looking at the scans. What about the don'ts? What should we try to avoid to minimize any potential harm?
I think one of the biggest don'ts is overreacting to every little thing we see on the scan, especially in people who aren't at high risk for cancer. Just because the WB-MRI shows something doesn't mean it's something to worry about. Remember, most of those incidental findings turn out to be benign.
So it's like a smoke detector going off. Sometimes it means there's a fire, but sometimes it's just burnt toast.
Exactly. We don't want to call the fire department every time someone makes toast, right?
Right.
Same idea with the WB-MRI. We don't want to do biopsies and cause anxiety over a little spot that's probably nothing.
Okay, so don't overreact to every little blip. What else?
Another important don't is to remember that there's a patient behind all this. WB-MRI is a powerful tool, but it's just a tool. It's important to remember that we're dealing with real people, not just scans.
So what does that mean in practice?
It means taking the time to really explain things to the patient. Make sure they understand what the WB-MRI can do, the potential benefits, and the risks, and involve them in the decision-making process. It's also about being aware of how all this can affect them emotionally. Even if a finding turns out to be benign, the worry and stress leading up to that can be significant.
So it's not just about the technology, it's about the human side of things too.
Exactly, and that's why communication is so important. It's not enough for the radiologist to understand the scan. They need to be able to communicate those findings in a way that the patient understands and feels comfortable with.
Okay, I think we've covered a lot here. We've talked about how WB-MRI can be great for catching cancers early, but also about the potential risks. We've talked about unco raids, why we need experts to interpret the scans, and how crucial communication is. What are some of the main takeaways you want our listeners to remember?
That's a great question. I'd say the 5 most important things are: first, WB-MRI can really change the game when it comes to finding cancers early, especially for people who are at higher risk. Second, on-Insecure RADS gives us a standard way to interpret those scans and decide what to do next. Third, having a radiologist who specializes in oncology read the scans is really important to avoid overdiagnosis and unnecessary procedures. Fourth, communication is key. Patients need to understand the potential benefits and risks of WB-MRI, and they need to be part of the decision-making. And finally, this is still a very new field. There's a lot we're still learning, and research is crucial to figure out how to use this powerful tool responsibly and effectively.
This has been so insightful. I feel like I've learned so much about the complexities of WB-MRI on NotebookLM RADS and the importance of personalized care. It's pretty amazing that we can scan the whole body for cancer now, but it also makes you wonder, where do we draw the line? Like, when is too much information actually too much?
That's a really important point. It gets to the heart of some of the ethical stuff around WB-MRI. It's not just about the technology itself. It's about how we use it, making sure it's responsible and ethical,
Yeah, let's talk more about that.
Yeah.
What are some of the ethical challenges that come with using WB-MRI to find cancer?
Well, one of the big ones is this idea of overdiagnosis. We talked about how sensitive WB-MRI is, how it picks up a lot of incidental findings.
Right.
The thing is, a lot of those findings, they might never have caused any problems for the patient.
So it's kind of like finding a tiny crack in a bridge, but the bridge is still totally safe to drive on.
Exactly. That crack might be there,
Yeah.
but it doesn't mean the whole bridge is going to fall down. And with WB-MRI, that tiny crack could lead to unnecessary biopsies, anxiety, even treatment for cancer that would never have caused any harm.
That's a tough one. It's like a no-win situation.
Yeah.
You either miss a dangerous cancer or you end up treating something that was never going to be a problem.
Yeah. It is a tough balance, that's for sure. And it shows just how important it is for the radiologist, the patient, and the doctor to all be on the same page, making decisions together. It's not just about finding something on the scan.
Right.
It's about understanding what those findings really mean and what the best course of action is.
So how do we deal with that gray area? How do we make sure we're not overreacting to every little thing while also not missing something important?
Well, one way is to really consider the person's individual risk factors. What are their chances of getting cancer based on their family history, their lifestyle, things like that. And also, what are their preferences?
Yeah.
For someone with a strong family history of cancer, a more aggressive approach might make sense. But for someone with no risk factors and a low ANSCO RADS score, a wait-and-see approach might be better.
So it's all about tailoring the approach to the individual person, not just having a one-size-fits-all protocol.
Exactly. And that's where good communication comes in again. The radiologist needs to be able to explain what they found on the scan and explain it in a way that the patient understands. Make sure they understand the uncertainties, the potential risks and benefits of different options. It's a collaborative process.
It sounds like radiologists have a lot of responsibility.
It is a big responsibility, yeah, but it's also an amazing opportunity to really make a difference in people's lives. If we use WB-MRI wisely and ethically, we can use its power to find cancers early and at the same time, minimize any potential harm.
This has been fascinating, a real deep dive into the world of WB-MRI and unco RADS. I feel like we've explored the science, the technology, and the ethics behind this cutting-edge approach to finding cancer. So thanks for joining us on this journey, and a huge thanks to our expert for guiding us through this complex and rapidly evolving field. Until next time, keep learning, keep exploring, and keep diving deep.